What do you love to do? And are you doing it in your practice enough? I mean, this is about loving this profession, loving dentistry. Last episode, I talked about seeing a rock and roller Bruce Springsteen, how hard he went. There's only one reason somebody with that much money and at 72 can do what he did. It's because he loved and loves what he does. We as clinicians, and myself included, we love dentistry. Hey, listen, there are some very smart, savvy doctors that understand everything that's going on in their practice. But for the most part, dentists are fixing teeth. They don't understand what's going on, and they rely on people who are less educated to run our business. We have every right to know everything that's going on in our business. Pay our bills, know what bills are going out, know what procedures need to be done. How does a doctor get started? By just making a list of things they want to start getting control of. Hey, welcome everybody, and thank you again for joining us at Dentistry Beyond the Numbers. My name is Dr. Marc Liechtung, and I'm here today to explain the meat of our 7-episode series. Today, we're going to discuss a word that's really gaining a lot of traction in dentistry, and that is EBITDA. What does it mean? How do I look at it? How do I judge it? And what does it mean specifically to my practice, my business? Without further ado, I'm going to call in the mechanic from the West Coast. He's the car guru who, if you can get there, he'll help you. Rolando Mia. I won't say your address, Ro, because you'll have cars down the block. But he's an exceptional person and a better mechanic. Ro, how are you today?
I am
Like
wonderful. Thank you so much for inviting me. I love sitting in on your podcast. It's amazing how much you're sharing, and I'm learning so much. I am especially interested today to hear about what you're talking about. As it turns out, I don't even understand what all this means, and I suspect other people have. So I'm really looking forward to getting into it.
You know, I really, through my experiences, came to realize that mystical word of EBITDA. It's a mystical word because you could throw it around and people are scratching their heads. Doctors are going, "What does that mean?" I'll tell you a little quick story. I mean, I went to look at a practice to evaluate a practice. The gentleman was really nice practice in his maybe early 70s or late 60s, and I sat down with him. I said, "Listen, I looked at your number. It's your EBITDA." He goes, wait. That's goddamn fucking number again. I don't give a damn about that word, he tells me. Don't bring it up. Don't mention that freaking word because that word means shit to me. I don't understand it and I don't know how to spell it. So I thought about it for a minute. I said, how many dentists really don't understand when we say that word and we throw it around? EBITDA. So I turned to the doctor and I said, let's substitute the word EBITDA for what we determine to be just operational profit or just the bottom line profit of our practices. Let me explain. So EBITDA, earnings, what does it mean? It means it's a synonym for earnings before interest, taxes, or taxation, depreciation, amortization. Again, what does it mean? What it means is your earnings, the earnings minus the expenses, are drop-down profit. And it's calculated before we take out your interest, your taxes, your amortization on your equipment. In other words, we do not calculate, or we as doctors should not be looking at our earnings and our EBITDA as everything taking from it. It's profit. Taxes that we pay are our taxes. Depreciation is our depreciation. That doesn't exist post either a transaction of any way. If you transition your practice to another purchaser, a family member, an associate, the things that you drew out of it, the expenses that you paid personally because your tax level is a certain level, does not hinder your operational profit. So in other words, Ro, it's still about more you could produce and the less you pay for expenses brings you a better profit and a higher EBITDA. That's really what it is.
So wait, how do you define, what's the definition of EBITDA then? What is it?
The definition of EBITDA is really the bottom line operational profit, the profit that comes at the bottom line of a practice after all the expenses are out. We paid all the owners. We have everything set aside, all the discretionary monies that a doctor would use the practice for, whether it be a personal renovation or a trip that they felt they could take on their practice, is built back into the EBITDA. We don't want to get into in depth, but what it means, Ro, is the definition of EBITDA is the metric of which we gauge our practice's value. So, in other words, if the EBITDA is $1 million, your profit, your practice's value, not the purchase, not the transition, but the value of the practice is very much at $1 million. There are other aspects that go into putting a price on a practice, but the definition is the metric that we use to define the value of a practice. Make sense?
Yeah. And so why is that so important for practice owners?
So let's take all ages. You know, the difference between EBITDA when you're in your 30s to your 60s is your decision, doc. You're positioning your practice as an asset. If you're in your early, mid 30s, upper 30s, you have an asset. You know what you're going to earn. The amazing thing is, give or take 4 or 5%, it's just about exact every year, unless, God forbid, we have pandemics, which we hopefully will be avoiding. But if, in other words, what I am saying is the gauge, the guide for us as valuing our personal businesses, doctors, is the word in today's vernacular, EBITDA, profit, operationally, because that puts the value. So if you're in your mid 30s, it gives you the ability to know my practice is worth this. If I wanted to bring in more technology, if I wanted to expand my facility, I have a practice that has a value of X. If I'm in my later days or I have a desire to transition to a group or to a purchaser, then I know my value is the EBITDA, what we described. That value is for me to go to market. And then it's just about what other things may come into play, which we will get into in a later session, but what other things come into play to put the purchase price or the ultimate exit plan, if I so determine. So at any point in time, I believe that we must know our drop dead profit or our EBITDA. Understand it. Understand the value or the metrics that makes up this value. Let's talk about what affects earnings. I mean, earnings is the number one way to drive your value up, because it is really hard to keep chipping away at expenses. And that's going to be really difficult in the sense of you can't keep firing staff. You can't keep cutting costs on supplies. But if you drive your earnings up of the procedures we talked about and the efficiencies of learning how to do them within the practice's four walls and not referring them out, now you understand why I keep pushing earnings, because you do not grow by cutting expenses. Again, you grow by procedural earnings, doing more efficiently, having better patient experiences. It all ties in to a phenomenal result, and that is a very high profit or EBITDA, which I could do whatever I want to do, whether I'm in my mid 30s, 40s, 50s, or 60s, or 70s. Whatever I want to do with that considerable, fantastic profit of a practice, I'll be able to do. Understanding that word EBITDA gives us sort of a blueprint of what I use it for as a dentist, and I've used it in my experience, is how am I going to increase from 2020 to 2021? How am I going to build my practice in 24 higher than I did in 23? Well, let's look at the earnings first. Are we doing Invisalign? Are we doing enough scanning? Are we doing implant placement within the practice? And if not, why not? So on and so forth will determine. So if you are in your younger days and starting off with a phenomenal practice, these are the ways to make calculated moves. I'm not preaching. I'm here because I really want to help. I want you to look at things differently. So many times I meet a doctor and that doctor is literally scared to look at the books because they don't know what they'll find. We must understand. We must understand the difference between what is our profit and what are we doing to just survive? Because we could spend an entire career thinking we've got X. And when we go to market or we go to hand it to an associate or a child, a loved one, a daughter, a son, or a nephew, or somebody coming up, we'll realize this practice from an EBITDA standpoint, from that operational profit standpoint, isn't that valuable. And that's what we want to try to avoid. So that row is what EBITDA and all the things that come in, the earnings that we discussed before the interest on any loan, before the taxes that you pay, before the depreciation of your equipment or the amortization of a note. Those things are taken out of the earnings. They're not calculated against our profit. And therefore, we must understand that if we earn more, we keep more through keeping our expenses down. For instance, Ro,
I'm loving the context around connecting it to the actions either early or during the process of running a practice. I love it. This is awesome.
I got to tell you, the earnings are just one thing. We talked last session about the expenses. And now I want to tie that into you doctors and think about it. Now you understand our discretionary money is not counted against our EBITDA. But our staff salaries, again, at a 65, 70, 75% value of our payroll to our gross top line revenue. And for those of you that don't understand, I just want to take a second. I want you to understand what I'm saying. Gross means everything that comes into our practice. Every dollar that's paid to our practice, that's our gross revenue or our top line number. Our net is when everything is out. What is the difference between net and EBITDA is a very good question, right, Ro? I mean, really, we used for years the word net. Now it's EBITDA. It really isn't much of a difference, except there are just certain calculations as an owner that is put into a transaction, which is termed EBITTA. We're not going to get into that, but that is a little more discussed. We'll discuss that a little further in the next session. But what I'm telling you is the net is what I want you to start thinking about as EBITDA. What is my net after I take my salary and is left in the profit of the practice? That really is EBITDA. And for those of you that are just like the doctor I talked about, gross versus net, or net being operational profit, is a good way to look at EBITDA because you won't be so far off. And what I'm telling you is salaries and expenses, labs that get away from us can destroy our EBITDA for no reason. Supplies. It's why I tell you to take a few minutes. Look at the supply numbers. Look at the numbers that you're spending on different things and see where you can find a savings, a better rate, a better deal, a better company, because everything you save drops down to your profit. There is no middleman when you're saving and going from 12 to 8. That 4% goes right down to your EBITDA, your operational profit, and therefore you want to borrow, you want to grow, you want to renovate, you want to sell. Whatever you want to do, you'll be in a better position to do it. The other thing is, we talk about marketing and advertising. It's the same concept. It all means the same. These are expenses. We want to watch our expenses. Expenses go down, the EBITDA or the operational profit go up. And that's the simple way, docs. I'm not making this a big case. The situation is really just earn a lot, do great dentistry, develop great reputation. Your EBITDA will be fantastic if you watch your back door. The back door is what's going out. Your expenses, lab supplies, we talk about it. You need to be your CEO. In dentistry, Ro, I look at us as wearing a lot of different hats, right? I've thrown for the last 6 sessions at you a lot of different things. First, I talked about getting better as dentists, right? I want to get better as dentists. I want to put in my different procedures. I want to become great. Then I want to understand how to really sit there and treat a patient like the top doctor in my area. I want to comprehensively treatment plan them. Then I want to understand I have to be a CFO. I have to watch my expenses. Now I have to be a COO, an operations person, to make sure all the staff is under pulling me. But in the end, the satisfaction, the gratitude that you know that you've built a successful, profitable, efficient, and quality practice is second to none. It's what we went to school for. It's what we've learned through these years. You know, a practice is that word. It's not called a job. It's called a practice because we're constantly getting better. This is a great way to really look at your office, look at the different things in your practice, and really determine, can I build my EBITDA? Can I build my operational profit? And that's how I want you to look at EBITDA. So the doctor that told me, well, I don't know about this freaking thing and this is all bullshit. Really, if you look at it and say, I'm going to get a grasp of the things that could really bring me down, and I'm just going to keep looking either for associates, myself, or specialists if I choose, to just build the earnings of my practice. It sounds simple, but you know, those procedures of what we discussed at the very beginning, Grow, you know, keeping in-house clear aligners and doing Invisalign, doing root canal therapy. Think about it, docs. We talked about root canal therapy. I know a doctor that every minute there's an exposure, he's sending it out. Bring in an associate or learn how to do single-rooted root canals. Crown and bridge and cosmetics. That increases tremendously by doing great cases. Extraction bone grafting, and understand these are avenues like we discussed of having to bring in associates. And that's a great pathway, which we'll discuss a future podcasts. And lastly, implant placement. The reason I chose these 5, and these 5 determine your earnings and how you present it. If you're a restorative person and everything else is, I don't believe in it, your earnings are not going to be as high as they could be. My belief is it all is one big hamsa, and that is the dental EBITDA. So really, it all works together. And today, understanding that in today's world, and today's world, it's all about that value. And then what else is in my practice? How is my facility, this and that? Those are things we're going to talk about next time. When we compare 2 practices, both grossing $3 million, how one positioned itself as an EBITDA of a certain $1 million number, straight at 30%, which is perfect, and the other one at less than 15%, 14%, too low to give the doctor what they want. So therefore, it's kind of interesting to watch this take hold and where it goes from the start to the beginning. Understanding this aspect is very important to position a doctor to have that business, whether they want to transition or not, to know when they put their head on the pillow, they know they've got a very profitable business. Understand, Ro? What do you think?
Totally. And I love the context around it. A quick question.
Sure.
What advice would you give people to help them get their heads around or start getting a better understanding of this thing, earnings, this whole EBITDA thing?
You know, I really think we should just, as clinicians, look at it as this way. Bring all these 6 major expenses and discuss it. Most offices, I hope, have an office manager or somebody in your team that you could gather certain bills and see where you could, at least for now, get an understanding of your expenses. And docs, what do you love to do? And are you doing it in your practice enough? I mean, this is about loving this profession, loving dentistry. You know, last episode, I talked about seeing a rock and roller Bruce Springsteen, how hard he went. There's only one reason somebody with that much money and that much and at 72 can do what he did. It's because he loved and loves what he does. We as clinicians, and myself included, we love dentistry. We do this, and I know personally, I am doing this podcast because there are so many, like the doctor that I met, not understanding exactly. Hey, listen, there are some very smart, savvy doctors that understand everything that's going on in their practice. But for the most part, dentists are fixing teeth. They don't understand what's going on, and they rely on people who are less educated to run our business. We have every right to know everything that's going on in our business, pay our bills, know how to pay the bills, know what bills are going out, know what procedures need to be done. How does a doctor get started? By just making a list of things they want to start getting control of. And if I believe that is essential in every aspect. Have a meeting. Don't rip it up. Don't tear down the practice. Just understand you might be better than you think. You might be in great shape. And if you're not, there are ways to get you better. And that is why this is being done. You know, I grew up in dentistry having mentors and people that taught me so much, and it became phenomenal to learn from them. They used to have a saying, learn from the best and share it with the rest. My experience, Ro, I've seen and evaluated many practices. And I must tell you that, you know, if I could help a young or an older doctor get no gain to me, if I can help them get their dream exit, their dream associate, their phenomenal result of their practice, that's worth so much to know that we as clinicians, as business owners, as people who have been dental lifers like you and I, you know, we've been here a long time. Give back, pay it forward, learn from this. It's essential, and that's how I think people can do it by understanding what's out there, what it means, EBITDA, how does it affect me? Don't be scared of it. You know, everyone's going to have their own, you know, their own things that they look at EBITDA. Stay focused on what affects you and your profit. Stay focused on things that have the ability to drive your EBITDA down. You know, that raise that we talked about. These are the things, and these are the things that can really hurt a great month, a great 6 months, and a great year. We need to take control. Ro, before I go on, any anecdotes, any questions?
Oh, this is great. Thank
Statements. You. How's the weather?
It's awesome. Oh, this is awesome.
Good. We're getting a little cooler here. And, you know, for me personally, a little side to the people that are listening, to the doctors, when it gets the end of August, you know, for dentistry, this is opening day coming. This is the time to get a grip of our practices now. Labor Day represents the break, and then right after Labor Day is opening day. It's sort of like, you know, that opening day of baseball. We're all looking forward to it. Smell is in the air, new thoughts, new goals. And I mean it. You know, I think understanding the profit margin, the EBITDA, the procedures, the expenses, and what you can do is so exciting. I would definitely say that it is opening day coming. Make a list. How am I going to start attacking the ability and attacking my practice in a way that in 3 months, it is going to be such a joy to walk in. There's going to be more efficient team members that understand. You may have them in your practice. You need to bring them out. You and your team needs to bring along the people that are not as efficient as your others. Make it all a team. Have huddles. You know, I just hired a new associate, and that associate told me, you know what I love about this practice? I said, what is it? They said, we have team huddles. Think about how we can attack EBITDA on a whole with a team huddle, understanding that we have patients that are coming in. Simple hello, good morning, happy birthday. Believe it or not, the courtesy to me, operational profit goes up. Why? More acceptance to treatment planning. Everything is tied in. So to the young doctors out there, don't get into bad habits. Your patients are your lifeline. They are the key to this whole series. Dental excellence is what we strive for. Profit is what we yearn to keep us going and to judge that our practice is successful and our family is taken care of. Don't lose that focus. And when opening day comes, look at it and embrace it. This is my chance to make a list. Things I want to attack day 1, day 31, day 61. We're not going to get everything at one shot. I throw a lot of things at you. I know that. My number, my email is on the bottom. It is always there for you. But bottom line is the bottom line. We want to make sure that you're walking and going to work, all of you, as happy as you can be, as happy as Bruce is playing 3 hours of rock and roll. We want to love what we do. And having a strong EBITDA, strong operational profit will definitely make us walk differently, feel differently, and love our profession even more. I want to thank you. And Ro, I thank you. I hope I stayed on topic because it's a strong one. EBITDA really is the definition of total practice success. We have to look at everything. In the next episode, as I said, we're going to compare 2 practices. And I'm going to show you how you can have, if you so choose, that great exit. I am not looking for anything. I said that at the beginning. I believe in mentorship. I believe in sharing and learning from the best. I did. I want to share it. I've had years of experience of looking at practices. I think somebody like myself who just wants to tell you what I think, as I do every day in my path of what I seek and my job, I want to share it with you solely so you can make the best decisions on everything you do practice-wise. That's all this is about, giving you the knowledge from somebody who's been there with the experience I have. I really thank you so much. And I thank you, Ro, for being so quiet. It was really enlightening. And not hearing from you gave me the ability to embark my experience on the doctors out there. So remember, next time we're going to get into a great comparison and why. But for now, I want to thank you. My name is Dr. Marc Liechtung. Thank you, Rolando Mia. And this is Dentistry Beyond the Numbers. Thank you.